Hello everybody, I am Dr. Aparna Simha, consultant pediatrician taking care of the Rare Clinic at ORDI. ORDI is Organization of Rare Diseases India. Firstly, I thank the organizers of RV College of Nursing for giving me this wonderful opportunity of speaking about rare diseases. Hello everyone. You all must have seen one or a few of these movies like Pa, Black, Tare Zameen Par, or Barfi. These are all the movies which have dealt with one or more rare diseases. So, what is a rare disease? A disease is considered as rare if it affects a very small percentage of the population of a country. Different countries have different definitions. For example, in the United States, if a disease is seen in less than 2 lakh people, it is considered as a rare disease. There is no specific definition in India. These diseases are rare in occurrence, they haven't been studied much and are not well known. Generally, they affect various organs, the physical capacity, mental abilities, and the behavioral and sensory qualities of the patient. These diseases tend to be serious or chronic and generally degenerative and progressive. The condition may be visible from birth or childhood, but some may not appear until adulthood. We may be wondering how many rare diseases have been identified. What's the number in India? According to the National Institute of Health, there are approximately 7,000 to 10,000 rare diseases. The number is only increasing because of the improved diagnostic facility and awareness. India has a whopping number of 70 million people suffering from various rare diseases. About 450 rare diseases have been identified in India. It is possible that numerous types of rare diseases are only waiting to be discovered. Stark reality is that 1 in 20 Indians is afflicted by a rare disease. What is the cause of these rare diseases? Well, 80% of the rare diseases are genetic in origin. In the rest of the cases, the cause is not known. 50% of the rare diseases are apparent at birth or early infancy, while others do not appear until much later in life. How to suspect rare disease, or how can a patient present to the doctor? This is a very important slide. A patient with rare disease can present with non-specific symptoms involving one or more systems, making the diagnosis really difficult. There can be varied presentation among patients suffering from the same disease in the same family. The patient can present with any of these symptoms or few or more of these symptoms. The patient may be admitted for various reasons frequently. The patient may come with specific symptoms, but no proper diagnosis may be made. There may be loss of appetite or increased appetite. The patient can present with distension of abdomen because of enlargement of one or more organs in the abdomen. There may be delay in growth and development. There may be repeated infections. The patient who is expected to grow in height and weight with time may not do so. There may be repeated ear discharge with or without deafness, or the child may be deaf since birth. There may be a decreasing vision, progressive decrease in vision with time, or the child may be blind since birth. There may be a delay or change in the speech pattern. The patient can present with frequent falls, with weakness in lower limbs or upper limbs. There may be involuntary or abnormal movements. The child may present with difficulty in climbing up or down the stairs. There may be a change in gait. By gait, I mean the pattern of walking, the style of walking may change with time. There may be regression of milestones. With regression, I mean a child who was able to do a particular activity may lose the skill, like walking, talking, or seeing. There may be progressive loss of weight or even obesity, rapid gain in weight. The patient can present with dysmorphic features which may be apparent since birth. By dysmorphic features, I mean there may be an unusual appearance of the eyes or eyebrows or the forehead or the hairline or the shape of the nose, dentition, the shape of the mouth, the positioning of the ears, the nasal bridge, or the fingers, or the whole structure of the body. The patient may look unusually different from others. There may be skin rashes or mucocutaneous ulcers. The patient can present with joint pains or deformities. The most common symptom by which a patient presents with a rare disease could be convulsions. The patient can present with repeated refractory convulsions. There may be frequent loss of pregnancy or failure to conceive in the mother when we go back to the family history. There may be a history of frequent neonatal births in the family. It's very important to take a family history, especially of 3 generations before the proband. So, by this, we all have understood that a patient with rare disease can present with a myriad of symptoms and signs. The average duration for diagnosis of a rare disease worldwide and in India is around 7 years. Now, because of the improvement in diagnostic methods, some rare diseases are being diagnosed in a much shorter duration, but still the average duration for diagnosis of a rare disease stays as 7 years. If we come to some examples of rare diseases, this is only a sample card. There are more than 7,000 to 10,000 rare diseases which have been identified. Nevertheless, we will have a look at some of the rare diseases. These names may sound fancy, but they are actually there among us. Lysosomal storage diseases like mucopolysaccharidosis, Gaucher's disease, Pompe's disease, neuromuscular diseases like spinal muscular atrophy, Duchenne muscular atrophy, Becker's muscular dystrophy, congenital muscular dystrophy, Down syndrome, Rett syndrome, Turner syndrome, inborn errors of metabolism like amino acidopathies like phenylketonuria, maple syrup urine disease, urea cycle disorders like citrullinemia, cystic fibrosis, amyloidosis, and the list goes on. You may be interested to know, do these rare diseases have treatment? How many patients with rare diseases do get treatment? Well, only 10% of the rare diseases have treatment and the rest 90% have no treatment. Only 700 drugs are available in the biopharmaceutical pipeline for rare diseases. Well, what is the reason for non-availability of treatment for most of the rare diseases? Many rare diseases are not well understood biologically, making it tough to plan and conduct a therapeutic development program. Performing clinical studies for such a limited number of patients might be challenging as the data collected is not sufficient. Because of the low prevalence of these disorders and the expensive cost of the pharmaceuticals, pharmaceutical corporations are hesitant to invest in treatment, leaving the goods orphaned and unlikely to be developed further or made easily available to the patients in need. These patients with rare diseases face a lot of problems day in and day out. Some of the problems experienced by the people with rare diseases are a delay in obtaining an accurate diagnosis. The average time taken, as I told you earlier, is around 7 years, by which time the disease may progress and the patient may be untreatable or may even die while waiting for the treatment. There are limited treatment options and little or no research is being done in the diseases. There is difficulty in finding doctors with awareness about rare diseases and also experience in treating these rare diseases. There may be difficulty in finding treatment centers or hospitals which are equipped with facilities to treat patients with rare diseases. If at all treatment is available for a small number of rare diseases, the cost is prohibitively high. There are other issues like reimbursement issues related to insurance, and most importantly, the psychological problems because of isolation, lack of treatment, and progressive nature of the disease is the most worrying problem faced by the patients with rare diseases. These patients feel orphaned by our own healthcare system. We can get information about rare diseases from ORDI, National Organization of Rare Diseases, and Genetic and Rare Diseases Information Center. Coming to ORDI, ORDI is Organization for Rare Diseases India. It's a national umbrella organization representing the collective voice of all patients with rare diseases in India. It was registered as a Section 25 non-profit organization in 2014. We have a vision to give better life for people with rare diseases and with the mission to be the strong united voice for all patients with rare diseases in India, to reduce the inequalities and ensure that people living with rare diseases have access to the same resources as any other population. Without action, there most certainly is no hope. Over 7,000 rare diseases and counting, what they need is an equally rare gesture. Hence, ORDI was born. What is my role at the Rare Clinic? I give consultation support for rare disease patients. I help in guiding and supporting the patients for diagnosis and supportive treatment. For any other support, I coordinate with my internal teams on behalf of the patient. I also coordinate with the external organizations for any new therapies, treatment options, drugs, diet plans, clinical trials, etc. I try and show the right path for the patients and caregivers for regular management. You may be wondering, what are the major initiatives that are currently being taken by ORDI and government to support such patients? How is ORDI instrumental in taking care of these patients with rare diseases? As a part of mass awareness, we conduct Race for 7. It's an annual marathon event across major cities in India to raise the awareness about rare diseases. We have completed 7 consecutive years in raising awareness, and 8th version is planned during February to March 2023. The Bangalore event happened on 26th, that is 2 days ago. ORDI helps in giving awareness to the medical fraternity by conducting Care for Rare webinar series with the support of SIAMG and AOCN to raise the awareness for practicing medical fraternity. So far, we have completed over 150 sessions on various rare disease conditions, and over 5,000 doctors have got benefited out of this program. ORDI conducts medical camps in rural areas and Tier 2 and 3 cities to identify the undiagnosed rare disease patients, and ORDI tries to show them the way forward for further treatment options. This is a picture of one of the rare disease camps conducted by ORDI. And Rare Disease Care Coordination Center. This is another activity of ORDI. This is a holistic approach which talks about the entire life cycle of a rare disease patient, right from genetic counseling, diagnosis, education to patients and caregivers, treatment options, leads for clinical trials, funding options to the needy through fundraisers. To strengthen this initiative, we have started our rare clinic where most of these activities are taken care of. This is the ward in Indira Gandhi Hospital, which takes care of the patients with rare diseases during enzyme replacement therapy. Well, the national policy for rare diseases. The government has come up with a policy last year and made an amendment a few months back. ORDI was instrumental in this. The policy talks about three groups. Group 1 diseases are those that are amenable to one-time curative treatment. Hematopoietic stem cell transplantation for lysosomal storage diseases or SCID, liver transplantation for glycogen storage disease, or renal transplant for Fabry's disease or autosomal recessive or dominant polycystic kidney disease. These patients are offered one-time payment of 50 lakhs for treatment and utilization by the government. The group 2 diseases are those that require long-term or lifelong treatment. This is to be owned by the state government through Rashtriya Arogya Nidhi grant. The fund may be utilized for special foods in inborn errors of metabolism or hormones or specific drugs like growth hormone therapy or IVIG in primary immunodeficiency disease or pancreatic extract in cystic fibrosis. Group 3 diseases are those who have treatment but very expensive. They would require lifelong treatment like enzyme replacement therapy. They can be facilitated through crowdfunding for which ORDI assists the patients. Coming to the activities of ORDI, ORDI promotes rare diseases as human rights priority through public awareness. ORDI contributes towards development of public policy and takes part in implementation also, such as rare disease policy and orphan drug policy. ORDI collaborates with advocacy organizations from India and people living with rare diseases, working jointly to connect them with national and international forums such as NORD, Eurordis, RDI, Global Genes, UDN, etc. ORDI strives to accelerate diagnosis and treatment options for patients with rare diseases through public-private partnerships and by advocating mandatory newborn screening. ORDI facilitates and encourages clinical trials, research and orphan drug development, helps in creating awareness among medical fraternity by conducting webinars about rare diseases, as I told you earlier. These are the rare care for rare webinar sessions which have benefited over 5,000 doctors. Now it has reached 6,500 also. Conducts annual large-scale countrywide awareness campaign to commemorate the World Rare Disease Day in the form of 7 kilometers run or walk or cycling. The number 7 symbolizes 7 years of average duration for diagnosis, 70 lakhs of people living with rare diseases in India, and ORDI has a dedicated helpline which functions 24/7 to cater to the rare disease community. The helpline being 8892 555 000. I repeat, 8892 555 000. So what is a Rare Disease Day? Rare Disease Day is an awareness event that takes place every year on the last day of February, either 28th or 29th, symbolizing the rare calendar date to focus on public attention on rare diseases as a public health concern. It was first observed in Europe in 2008. Now it is observed globally across 85 countries in the world. On this Rare Disease Day, patients, their caregivers, families, researchers, advocates, and others get involved through storytelling, media interviews, posting stories, videos, and blogs online, educational initiatives in classrooms and on college campuses. As I told you earlier, in India, Rare Disease Day is being celebrated by ORDI as a 7 kilometer run or walk or cycling. And this year, this year's Bangalore event was celebrated 2 days ago. These are all the patients who have sent thank you messages, and these are the awards and recognitions for ORDI. You can participate in Rare Disease Day by registering at registration.racefor7.com. Thank you all.